Welcome back, everyone. Scientists have created mice that are the genetic products of two fathers, but many of their peers aren't impressed here. Researchers at the University of Texas engineered a female mouse whose eggs contained DNA from a male. And when the mouse mated with another male, the offspring contained DNA from both male mice. The scientists say it means that someday, two men could produce their own genetic children. Well, the scientific community argues this would be very complicated and extremely controversial. A new warning from the U.S. Surgeon General finds even brief exposure to tobacco smoke can be harmful to your health. The report shows cigarette smoke immediately damages cells and inflames tissues, leading to serious health issues. Researchers found the effects come from smoking and secondhand smoke. The Surgeon General says one cigarette can be enough to cause a heart attack. A study published in the Journal of Infectious Disease finds certain flu viruses are becoming drug resistant. Researchers warn this could increase their ability to spread quickly. This also makes the different strains more dangerous. So Dr. Alan Magaziner from the Magaziner Center for Wellness is here to talk about this. All right, you know, flu season is upon us. We all heard everybody get a flu shot. Now we got different strains. Our bodies are becoming more resistant. What's going on?
Well, certainly are. I mean, not only for viruses, but also bacteria now, too, as well. I think we're using so many more drugs than we used before. And every little time we have a sniffle, sometimes the doctors, unfortunately, I think, overprescribe sometimes. I think sometimes the patients or the families want that. They're looking for a medication. Unfortunately, what we're seeing now is more and more drug resistance, and especially now against some of the new flu viruses.
Well, that's disturbing, especially when so many people are coming down with the flu. Do you still think that people should get flu shots?
Well, I think only a limited number of people should get flu shots, really. I think those who are at risk, especially if they're immunocompromised, those who may be diabetic or those who may have cancer, I think those people maybe should have flu shots. But I don't necessarily think all the healthy people in our society should have flu shots.
This story really grabbed me today, another one that came out that said breast cancer patients should consider weightlifting. And I find this interesting because prior studies said not to.
This is the first study that's really contrary to everything that we've been taught and told. Up until now, doctors have told us not to lift anything more than about 5 pounds after having breast surgery, especially if you've had some lymph nodes removed. Now what this study has said, hey, wait a minute, maybe we were wrong. And maybe it's better if we do lift a little bit of weights. It may help reduce what's called lymphedema, which means swelling and pain due to fluid accumulation as a result of the lymph node dissection.
Is that why they also recommend lymphatic drainage therapy, physical therapy, lymphatic drainage massage?
Absolutely. And all these modalities may be beneficial to us is what we're finding out now. But it's very important if you are going to lift weights after having breast surgery that you do it under medical supervision and have a trained and skilled and professional individual who's able to put you on a program properly.
And usually physical therapists can do that.
Absolutely, yes.
Okay, the last one, we've talked about mammograms before, but there was this new study that came out that said that half the women who are recommended to get mammograms actually do, even if their insurance covers it. So we don't have all the women out there actually going to get mammograms. Where do you stand on that?
Well, I think it's okay for those, once again, who have family risk. Unfortunately, a lot of women, whose mother or grandmother or sister had breast cancer, I think those people are those who are obviously at risk. Those people may need mammograms, but for the average individual who's relatively healthy with no risk factors, I think we could start at age 50 instead of age 40.
So you agree with those rules that were put out last year?
Yes, I do, by the U.S. What's called Preventive Task Force.
All right, so it's really just the people at risk who have a history in their family. I think it's an interesting trend, though, that these women are not getting it. Is it because there's a fear? They don't?
I think people, right, there's a fear, it's uncomfortable, it's painful, and I think sometimes they forget when they've had it done last. I ask my patients all the time, maybe, when was your last mammogram done? Half the time they can't even tell me the answer.
Wow, maybe you should be part of that annual exam. All right, Dr. Alan Magaziner, thank you so much for joining us. As always, great information.